Hi, and welcome to this short video overview of the Arjo Skin IQ therapeutic surface. If you didn't have an opportunity to attend an in-service on the Arjo Skin IQ therapeutic surface, you can use this video as a quick reference tool or even as a refresher. The Skin IQ therapeutic surface is not a mattress. It's a foamy mattress cover that allows water vapor to dissipate quickly. It is used to ensure that patients stay dry. It goes on top of a waffle. Now let's watch the video on the Skin IQ therapeutic surface presented by the Arjo representative.
Hello everyone, my name is Louis Barandi. I work for Arjo, and today I'm here to present the Skin IQ Microclimate Manager. Okay, so as you can tell, it is not a mattress. It is a cover sheet that will fit over any of your existing mattresses, especially with the waffle on top of it. So your mattress, regular mattress, foam mattress, your waffle on top, and this can fit over it. Now, the new algorithm that the hospital has created, if you feel there's a need on, as far as your grading score, to rent one of these, our instructions are that you must speak to your assistant head nurse, and your assistant head nurse will speak to Josephina, who will order the product from us on a rental basis. Okay? The product is really meant for those patients that you feel have a problem with humidity or moisture. Okay? The purpose of this is to keep your patient dry on top of this mattress. So if they're sweating a lot, humid, we recommend that you use our Skin IQ on top of it. Our technician will come in and install it over your mattress. Of course, the patient has to be out of the bed for it to be installed. And you'll notice at the foot end, there's one important product here, which is a fan, which makes this unit work. And I'll talk about that shortly. And this is always at the foot end of the bed. The reason is it does vibrate a little bit and it does make a little noise. Not much, but a little. So we don't want it at the head end of the bed. Okay? And as you notice, it is plugged in and it's plugged into one of the outlets of your wall. Now the simplest way to show you or demonstrate prototypes that I have here. Okay, so pretend this is a regular sized mattress that you have underneath, okay, with the same type of topper that you use. The other one right beside it is the same thing, except with a Skin IQ on top of it. And what I have here is just a regular water bottle, okay? And what I'm going to do is just put 2 squirts of water. 1, 2, put this on top. 1, 2, put this on top. And you'll notice that within 2 minutes or so, the water that's here will disappear. And the reason it does is because this fan is pulling away all the water vapor from a patient. Okay, not water, not liquid, because this product is impermeable to water and liquid, but the water vapor can go through the top layer. This is a little cutaway. So you have a top layer that's made out of nylon taffeta. Okay, and that's this right here, the top portion. Underneath it, you have a foam. So if you press down on it, you can feel the foam on it. It's not a sponge. It's not going to absorb the water. Okay? All it's doing right now is the fan is pulling the water vapor out the foot end of the bed. You don't have to be concerned about water dropping on the floor because it's not liquid water, it's water vapor. So the water vapor goes into the room. Okay. There are a few important rules if you do use the Skin IQ. The first thing is you must use a disposable PK. Okay, this one I have here is basically the dry flow. I'm not sure if you've seen this on your floor before, but the hospital has other types of disposable PKs that are breathable, and that's all this is. It soaks in the liquid, so if you're concerned about urine or any other liquid, this will absorb it, but it will allow air to go in both directions. Okay, so you must use the disposable one. You could use 1, you could use 2, you could use 3. as long as it's the disposable. The reason is your reusable ones are very thick and some of them are plastified on the bottom, so it won't allow air to go through. Now this product is on rent, so if you were to use a reusable one, unfortunately you're not getting the full benefit of the Skin IQ. So you must use these disposable PKs. Now the product itself is a wipe down unit with whatever product you're currently using to wipe down. Okay, so if it gets a little soiled, a little urine or whatever, you can wipe it down with your lingette or your serviette, whatever you have currently. Now if it gets really soiled, okay, and I mean feces or blood or any other liquid that you're concerned about, and you look at the top of this and you go, ooh, it's not looking good, you ask your head nurse or assistant head nurse, we will replace it. We will take care of the cleaning, picking up, and bringing another unit back either the same day or the very next day. Okay, working days. Okay. Now you'll notice that the top portion of it is very slippery. And it's slippery because we also want to prevent friction and shear. As far as one of the factors of pressure ulcers, we want to try and decrease that. So our recommendation is to put the patient directly on this surface, of course, with a PK. However, if your patients do not like the surface and complain, and many do, okay, because they find it slippery, you can use a fitted cotton sheet on top. It's not going to affect the efficiency of the fan and drawing the water vapor, but it will affect the sense that there will be less friction or more friction and more shearing going on if you put a cotton cover sheet. But you can put a cotton sheet or fitted sheet over it if you wish. If you do require this according to your algorithm, once you speak to your assistant nurse, we will come in, we will set this up, we will install it, plug it in, make sure it's working. If your patient is discharged, you must notify your assistant head nurse to say the patient's going home. We'll come, we'll pick it up and bring it back to our facility to have it cleaned. Now if you're in a rush and another patient's going to be coming in soon, all you have to do is roll it up, put it into a plastic bag, keep it in the dirty utility room. Our technicians will come by and pick it up. Okay. Also on each side we do have Velcro attachments. Okay, and this is basically to secure onto the bed frame so it doesn't move around a lot. So you just have to Velcro it to your sides and attach it. Okay. Is that this fan has to be working for it to function. And all it is a simple computer jack, okay, which is plugged in. There's no on or off switch, so it has to be plugged in for it to work. Now this will be over your bed mattress like this. So every day, if you do come around and you do your rounds, to make sure it's working, you can put your hand there at the end of the bed and you'll feel it vibrating. Or you could put your ear there and you could hear the fan moving. Now the problem is if the bed is moved and it becomes disconnected, it's not working. So it has to be plugged in for it to work. And that's it. Any questions? Yes.
Please note that an Arjo technician will be present at every installation of the Skin IQ therapeutic surface. Please refer to the therapeutic surface decision tree posted on your unit for details on selecting appropriate therapeutic surfaces and ordering one for your patient. For more information regarding the Skin IQ surfaces, please consult your assistant nurse manager, nurse educator, or contact Arjo using the number provided at installation.